Bipolar disorder is a chronic and severe mental health condition that is characterized by pathological changes in mood, marked by episodes of mania or hypomania and depression over a patient's lifetime. The National Mental Health Survey estimates the lifetime prevalence of bipolar disorder to be 0.5% of the Indian population, which means about 70 lakh Indians suffer from bipolar disorder at any given point in time. Despite effective treatments, stigma and lack of awareness often cause delay in treatment seeking, thereby leading to a fairly complicated course of bipolar disorder. Hi, I am Dr. Muralidharan Kesavan, Professor of Psychiatry at the National Institute of Mental Health and Neurosciences, Bengaluru.
What are the key signs and symptoms to diagnose bipolar disorder?
So the main symptoms of bipolar disorder are pathological changes in mood. For example, in mania, the patient could have increased happiness, while in depression, the patients may experience severe levels of sadness. Apart from this, there is also a change in energy levels, with patients with mania experiencing increased energy and those with depression experiencing decreased energy and a feeling of tiredness at all times. In addition, there may be disturbances in sleep, appetite, and other biological functions. Sometimes psychotic symptoms may also accompany the clinical presentation of bipolar disorder.
What causes bipolar disorder and why is early intervention important?
Bipolar disorder is caused by numerous factors, but the most important one is a strong family history of bipolar disorder. Bipolar disorder is characterized by neurochemical changes in the brain that then produce the symptoms of mania and depression in patients. Now, what happens in bipolar disorder is that over the course of the patient's life, the episodes tend to become more frequent and more severe, thereby leading to a lot of morbidity. With early interventions, we can alter the course of illness and ensure that the patients can lead a more optimal and productive life.
What treatment options are effective in managing bipolar disorder and to prevent relapse?
There are many treatment options for bipolar disorder, but medicines remain the mainstay of treatment for bipolar disorder. Lithium is the gold standard drug. Apart from that, second-generation antipsychotics and anti-epileptic medications have been used successfully to treat and prevent future episodes of bipolar disorder. Despite all this, the most important factor remains adherence to treatment. It is important that patients take these medications regularly, follow the advice that has been given by the treating doctor, and attend follow-ups regularly to ensure that the patient stays well and relapses can be prevented.
How can families and workplaces create a supportive environment for individuals living with bipolar disorder?
Patients with bipolar disorder require our empathy and support as they navigate their way through this difficult illness. Now, what family members can do is ensure that patients take the medications regularly and attend the follow-up treatments as advised by the treating doctor. At the workplace, the employers and colleagues must ensure that the patients with bipolar disorder are provided as much support as possible and to ensure rhythmicity at the workplace so that the patients can be comfortable. At the end of it all, it is empathy that matters most in ensuring that patients with bipolar disorder are well supported in society. With early diagnosis and effective treatments and strong support systems at home and in the society, we can ensure that persons with bipolar disorder lead successful and fulfilling lives. Reducing stigma and enhancing awareness about bipolar disorder in the society are key steps to ensuring better outcomes for patients.